According to HIV.org, HIV/AIDS, or human immunodeficiency virus, and acquired immune deficiency syndrome, was first documented in 1981. The initial outbreak drove the world of health and medicine to a nearly global response in efforts to derive treatments and find a cure, and today's casual romantic and sexual relationships have resurged the relevance of sexually transmitted disease and care. My name is Jake Colson, and I'll be presenting a brief history of HIV/AIDS, its coincidental discovery among patients with degrading immune health, and the first aggressive treatments that were expedited to fight the epidemic to make success. Modern medicine has radically improved the quality of life of AIDS survivors, and gene therapy has brought conversation of cure closer to horizon, but cost and availability of treatments still leave work to be done. Unlike typical viruses, retroviruses like HIV/AIDS invade the host cell's transcription of DNA strands without lysing, remaining asymptomatic during transmission and early replication. Viv Healthcare describes that HIV targets CD4 plus T cells, white blood cells that identify, memorize, and remove contaminants. It's transmitted through blood, breast milk, and intercourse, and takes upwards of years before symptoms of advanced HIV/AIDS present. Rates exploded in the 80s amid low information on methods of contraction and prevention and high rates of unprotected sex. HIV proliferates dormant within cells and deteriorates body defenses from additional diseases before the accumulation of AIDS, not dissimilar to viruses like COVID-19. According to HIV.gov, the first official mortalities that have been retroactively linked to HIV/AIDS trace back to June of 1981. It would take a year before acquired immune deficiency syndrome would enter the medical lexicon, being predated by inaccurate, sexually oriented terminology like gay-related immune deficiency, or GRID, which would improperly categorize HIV/AIDS as an issue solely affecting the gay community. Deconstructing the stigma and creating care options for victims would take advocates like Ryan White, a hemophiliac who publicly battled the court system to return to high school post-diagnosis after a contaminated blood transfusion in 1984. He would win, but would sadly die of complications of AIDS at the turn of the decade. The first treatments for HIV/AIDS were principal antiretroviral therapies, or ARTs, laden with side effects. Despite success in reducing mortality rate and disease progression for patients, the effects on quality of life demanded advancements in care. Alice Sang with the National Library of Medicine states that the first ART medication released in 1987 was named Zoodovidine, or AZT, which successfully repressed transcription of infected copies of DNA and HIV spread. AZT and other transcription-inhibiting ARTs were often administered in excess to maximize their effectiveness, and the associated cost and time consumption would be just the first of many drawbacks associated with treatment. Singh continues that adherence of over 95% accuracy to these regimens was necessary to maintain blood levels high enough to fight HIV spread, an increasingly unrealistic figure in the sight of expense and availability of early medication. AZT, the most widely available and implemented transcription inhibitor in the 1990s, cost patients $10,000 annually upon release, and due to interactions with other medications and toxicities associated with high dosages, was often more immediately impactful to the patient's health than initial diagnosis. ART and antiretroviral medicine would take years to clinically trial, and many lives would be improved and scarred by the effects of the first evolutions of HIV treatment in pursuit of cure. Medicine today is very effective compared to early forms of ART, and advancements in gene therapy have brought concepts like cure closer to HIV/AIDS patients today than ever. Addressing drawbacks associated with antiretroviral treatment, supporting medications were developed that alleviate the physical toll and toxicity of ART. Development of gentler compounds maintainable at lower adherence helps decrease difficulty and side effects associated with HIV management. According to Viv Healthcare, ART treatments have progressed today where HIV can be reduced to undetectability in a patient's blood, preventing further transmission to others. Challenges preventing a cure for HIV lies in guarding the CD4 plus T cells, as they're found in most tissues in the body, with white blood cells being the vast majority. The new therapy attempts to induce dormant HIV genes to express, marking them for removal amid the human DNA before they can replicate. Therapies designed to isolate the virus from the body's reservoirs have brought the cure closer to reality. Some gene editing therapies like EBT1 are under trial and may approach the consumer market as early as this year. In advanced effective care and management of HIV infection today, lasting challenges to victims remain in cost and availability of advanced care, like in third world countries with limited infrastructure. The future of HIV/AIDS advocacy lies in making successful forms of care more available to the masses and continuing to deconstruct the stigma formed so early into HIV's history. Since its discovery, HIV/AIDS was transformed from a death sentence to an increasingly manageable disease, and this is thanks to the thousands of hours devoted to the cause by scientists, researchers, and patients alike. From early misconceptions to the journey that antiretroviral therapy has undergone over the decades, HIV has duly united society to face such a pervasive threat to public health. With treatment available, an expanding young adult population, information on care and prevention of HIV is as relevant now as in the height of the epidemic of the 80s. Advocacy and information continue to be the greatest weapons in fighting the spread of HIV and help realize the future of affordable universal